Hello, everybody. StephenGray here again. It's been a while since I did one of these. It's now January 2023, and I'm continuing with this series of interviews with leading influencers in fields related to psychedelics and consciousness transformation, with the overarching mission, you might say, to uh, make some contribution toward a planet that's in, you might say, dire need of a consciousness transformation for the generations to come. And today I have a very interesting person that I'm going to interview, and she's with me now, and I'm just going to introduce her first with some short text. Her name is Dominique Morisano. Dr. Morisano is a clinical psychologist and adjunct professor at the University of Toronto and University of Ottawa. She's received extensive training in psychedelic therapies from multiple institutions, including the Certificate in Psychedelic Assisted Therapies and Research Program at the California Institute for Integral Studies. She served in executive leadership at the psychedelic therapy company Field Trip Health for 2 years, and currently runs a trauma/addiction focused private practice in both Toronto and New York City. Dominique also acts as an advisor, trainer, and consultant for several institutions in the psychedelic therapies space and teaches in the Psychedelics and Spirituality Micro Program at the University of Ottawa. As well, she's a co-founder and chair of the board of nonprofit psychedelics R2R, which was behind the 2022 Hybrid Psychedelics Research Conference, From Research to Reality Global Summit on Psychedelic Assisted Therapies and Medicine. And that, by the way, was a condensed resume or bio for Dominique. I don't know how she's done all this in the amount of time she's had on planet Earth, but nonetheless, welcome, Dominique.
Thanks.
Yeah.
I'm older than I look. Yeah.
Oh, yeah. Well, you look great, and just like your picture, by the way. So let's just get right into it. And this is a question that you probably get asked occasionally if you do interviews, but I always find it interesting anyway. And the field you're in is not necessarily one that a lot of people in the same field would pursue in terms of going toward the use of psychedelics and related medicines. And so may I ask you what led you in that direction?
Sure. Well, back in about 2008, I was an addiction researcher, and I was doing a postdoctoral fellowship in addiction psychiatry. And I was at a conference called the College on Problems of Drug Dependence. And there I met a bunch of psychedelics researchers like Matt Johnson and Chad Riesig, who ended up at FDA eventually. And I really connected with that group at Johns Hopkins University, and we became good friends. And I was studying cannabis and alcohol, and really had at that time not much interest in moving over to psychedelics, but they were always trying to kind of convince me that that was the place to go. And then in 2013, I was working as a scientist at the Center for Addiction and Mental Health in Toronto, and my boss told me he was retiring early. This was Brian Rush, to go work on ayahuasca research. And I said, "What? Ayahuasca research? What is that?" I hadn't even heard of ayahuasca before. And I started looking into it and I said, wow, what? All of my friends are starting to research these psychedelics. And then I will say that, I was working with a lot of clients with trauma and addiction issues, and a lot of people would get better. A lot of people would get, I would say, even 100% better. But there was also a good, I would say, chunk of clients that would get to about 90%, like 85%, 90%, and seem to plateau. Like we could go so far, but we couldn't, whether it took 1 year, 6 months, 2 years, 3 years, like we kind of hit that top edge. And I was thinking about how much time, like, and how much struggle people were experiencing, and the data around psychedelics were starting to come out around how they impacted, depression and cancer, and smoking cessation rates, and all of these things. And I started to think maybe this is something that would be interesting or useful for clients like mine. And at the same time, I had also been in a, a series of accidents, like, car accidents, like,
Mm,
and a series of physical traumas myself. And I was looking, I'd been doing all kinds of treatment for years, but was looking for solutions also for myself, as, how I would move through that period in my life. And, uh, you know, basically, yeah, started to find that maybe psychedelics were going to help me a little bit. And so I started reading lots of research, doing all the research I could do around the subject. And then in 2018, I was Matt Johnson had recommended I read this Michael Pollan book. I read it and I said, learned about CIS and as that there was this whole school program for this area. And I said, that's it. That's what I'm doing. I'm going back to school. So, and yeah, that kind of, once I made that decision, everything just started kind of flowing.
So I did want to ask you about cannabis though, because that's been something I think that's been a focus of mine with my book Cannabis and Spirituality, et cetera, et cetera. And you've focused on that as well. And you talked about you've focused on cannabis dependency and so on. And I'm just wondering if you can say some things about, I don't know, just generally how what do you see are the pros and cons of cannabis use in general, and maybe different ways of using it or that sort of thing.
Yeah, I would say, I would say I got into working with cannabis dependence and research at Center for Addiction Mental Health probably in about 2006. And I was seeing I was working in the youth addiction program and was seeing a lot of kids coming in with pretty severe dependence issues with cannabis. So um, sm basically smoking a lot from morning till night, and kind of drowning out their existence, not really being present in day-to-day life. And I think that's, I think so. So I personally am not anti-cannabis. Like I am, a person that sees it as a beautiful plant, that unfortunately causes pretty serious problems for about 10% of people that use it. That seems to be what the research shows.
Hmm.
And so for those people, for those 10%, it can wreak real havoc on their lives. And I've seen people go into bankruptcy, believe it or not, uh, from running out of money, needing to still have it every day, and really impacting motivation, goal setting, future oriented thinking, decision making, emotional, regulation, like kind of blunting emotions,
Hmm.
and fogging things up. And so I was interested in helping people, break free, kind of reduce harm, the harms related to their use of cannabis, and see if they could, um, depending on what would work for them, whether they would take it out of their life completely or find a more, um, let's say, functional way to use it in their life.
Hmm.
So I think that there's been a lot of interesting research about cannabis for pain, for neuropathic pain, for epilepsy, for a lot of different conditions. Um, I'm I know that there's growing, like people are researching it all the time. I was looking at potential cognitive impacts in people with schizophrenia because there was an inordinate amount of folks with schizophrenia that were using cannabis, and we were trying to see if it made things worse or better.
Hmm.
Um, but yeah, I mean, in terms of cannabis in general, you know, I would say it's a neutral substance, it's a neutral
Hmm.
plant, right? And you
Yeah.
can go this way with it or you can go that way with it. And, I help the people that go that way. And the people that go this way don't need my help, right? Um, you know,
Yeah. No,
and
good.
so, yeah, that's kind of how I see it.
So I don't want to get the thank you. I don't want to get too waylaid on cannabis because we have other important things I want to ask you about. But I can't help but ask this anyway because it's a curiosity to me. Um, I know people who smoke, 2, 3 times a day and are extremely functional. But I
Hmm.
have my doubts about that. It's never
Hmm.
something I've wanted to do, except maybe when I was 20 for a year or two,
Hmm.
and didn't work all that well for me even then to do that. But some of these people seem to be quite high functioning, and
Hmm.
I'm just wondering. To me, my if I had a bias or an opinion about that, I'd think, well, that's fine, but are you potentially just using cannabis in a palliative way and, in a sense, ignoring issues that you might, if you're really on the spiritual path, so to speak, want to dig into more? So I don't know. I know you're obviously focused on, the problematic use of cannabis, but have you seen perhaps just in general, people that are able to use cannabis in a daily way, in a positive way, or what's your take on that?
Um, well, what's interesting about being a psychologist is that, you don't get to see those the people that are doing so well
No.
that much, right? Like you get the people with problems, but I can say that I think a lot about cannabis and one of this is probably controversial to say, but like one of my teachers in Peru, an ayahuasca teacher, Ricardo Amaringo, apparently he said, marijuana takes you to the spiritual gates, but it doesn't let you in.
Mm,
Um, and that's his view that that he tries to help people get off of cannabis use, except in a traditional medicinal like kind of dieta context, like with proper prayer and rituals around that
hmm
use. I think that I see a lot of people that come in and they say, "Oh, this is my problem. This is my problem. This is my problem. This is my problem. This problem." And then at the end of the session, they're like, "Oh, by the way, I also smoke weed every day. I just wanted to mention that." And I said, "Oh, is that why you came to me? Because that's what I was one of the things I'm known to be working with." And they said, "Oh yeah, kind of." And I said, "Oh, is that something that you want to work with?" And usually they say, "I don't know. I don't know. I think I
mm,
function pretty well, but I'm not
mm,
sure it's something I'd like to explore." And so I think that, for a lot of people, it is a coping skill. It is a harm reduction technique. I mean, if you're going to be doing that versus drinking alcohol, you know, every night, or you're going to be doing that versus using opiates frequently, well, that is certainly a great thing, right?
hmm
And I I just think it really depends on the person. I mean, I'm sure a lot of people exist that have great experiences using cannabis every day with no issues, but I uh, um, haven't met them
mm, right.
personally,
Yeah, sure.
and so. And I will say that even my clients that say, I want to work on all these things, but I don't want to work on cannabis, that's not the issue. A lot of them eventually come to work on their cannabis use.
Yeah, that's
Um,
that's good. Well, again, I don't want to, spend too much of our precious time here on that theme, but I have known people that, well, one guy in particular I remember who was really big on, I think he referred to himself as a wake and bake kind of guy, and he
mhm,
was very active in his life. He wasn't a couch lock kind of guy at all, but
mhm,
he did go cold turkey at one point, and I asked him,
mhm.
what he noticed. And he said everything got clearer. I thought that was
Yeah,
very interesting. Yeah.
that's what people tend to say is like the veil is lifted, right?
Yeah.
Which is hard, right? And if you're not ready for that veil to lift, like if you don't have other coping skills, you don't have other ways of taking care of yourself, then I say put the veil back down, right? Because
Mm-hmm.
usually when I work with people with cannabis, we don't start day one working on cannabis, right? I'm working at least for usually a month or two with them on other things like exercise, like finding good social supports, like, having good sleep, good self-care, things like that before we address that. Because if you lift the veil and you're not able to deal with what comes out, or you're not able to, cope with what you see,
Mm-hmm.
well, then that's going to throw you into a deeper spin, right?
Mm.
And so I try to help people have the skills to lift the veil and then work with what they see, rather than, put the veil back down again. But if it's not the time, it's not the time.
Yeah, very interesting. Yeah. So actually, I'm glad we're talking about that because it is related to addiction and dependency in that sense. And from my point of view, in certain contexts, used certain way, cannabis should be considered part of the psychedelic pantheon, even though it's
Mm-hmm,
not technically a psychedelic and doesn't act on the
mm-hmm,
5-HT2A receptors, etc. But then getting into the normally considered psychedelics, the so-called major ones, I guess you could say, you focused on them in trauma and addiction work in your
mm-hmm.
studies and so on, and advocacy, et cetera, et cetera. And so, can you talk, perhaps in a somewhat general way, about how psychedelics can help in how they are used for those purposes?
Sure. I mean, I can speak to the extent of, what I know. But, because I'm an addiction psychologist, so I've been working with addiction for about 17 years without psychedelics. And maybe a couple of years ago, I started working, and this isn't a classical psychedelic, but with ketamine, with some substance use issues like related to alcohol and cannabis. And interestingly, even though it wasn't the main goal of that work, the folks I was working with did have some issues in those areas. It became immediately apparent how effective it was at impacting those things. Like, I might have I had a session where in the middle of the session, someone said, "I hate alcohol. I hate alcohol." The very first
Mhm.
session, and otherwise was having a very psychedelic experience, but just came out. I hate alcohol. I said, "Oh, okay. I'm going to write that down. What do you hate about it?" "Everything, everything. I hate everything about it. It's a poison." "Okay." And then kind of went back in, and later we talked about it, and they were able to cut down their drinking, oh my gosh, from I think like 35 a week to 2 a week, and those effects sustained for the preceding 8 months that we were working together. um, I was working with someone for several years without any kind of psychedelic support, just in regular psychotherapy, and a very serious cannabis dependence. And they had only ever been able to go, 4 to 6 months without cannabis at a time. That was the longest stint in like about 7 years. Um, and first day after the ketamine session, quit. After the first ketamine session, like in a series of six. And it's been about, yeah, 5 months since then. It hasn't returned. And things have just started shifting in their life. And, I would say that in general, it's still it's still somewhat mysterious to me how it's so effective so quickly. But I can say that people are able to see themselves really clearly,
Mm.
and it's like they're able to see, how they're caring for themselves, what this thing is doing to them. I'm not an expert on ibogaine or working with opiates. That's not my area. The main addictions that I've been working with, like over the years, are cocaine, alcohol, and cannabis. I know that there's definitely potential for psilocybin. Matt Johnson's done those studies at Johns Hopkins with cigarette smoking, like showing wild quit rates that you never see with any other tool, like nicotine patches or gum or, vaping or anything like that. I think some upwards of 70% quit rates, after a year, which is absolutely unheard of. And so I think it's something that we have to start really researching, exploring. I know Elias Dakwar was doing work on with ketamine and cocaine and alcohol, and was showing efficacy. So we don't have the protocols yet, but I think this is going to be, if people put the time and the money into it, if people actually work on this, because I think often, my feeling is that often like addiction is one of those things that's left behind in care and service money, and the money that people
Hmm.
put into the public health system. It's like, well, why do, there's a lot of judgment and I think bias about people struggling with addictions. People aren't able to look at all the societal factors, traumas, intergenerational traumas that cause someone to turn, towards a plant or a substance, to cope and get through life, Um, I really see substance use as a coping skill, in the addictive sense, and have no judgments about it. Some of the most interesting, creative, smart people I've ever met in my life have been clients I've worked with addiction issues, which is part of why I got so interested in working in that area.
Yeah, sometimes people, the kind of people you're just referred to are uh, more sensitive in a way than a lot of people, and so they have more inner stuff to deal with in a certain way, right? Um, does that make sense? Uh, okay, so let me tell you a quick
Yeah,
story. I'm supposed to be
yeah,
interviewing you here, but
it's okay.
have you ever heard of Mayor Baba?
No.
Mayor Baba was fairly popular guru, I guess you could call him, from India in the late 60s and 70s. He had followers in the West and so on. And one of the stories he told was that at a certain point of his life, he undertook to find the people, he called them musts. He said they were people who were, this obviously implies accepting the principle or the idea of reincarnation. And Mayor Baba had seen people around India that he felt were really advanced spiritually, but had fallen on barren ground, the kind of things that you were just talking about, intergenerational trauma, whatever,
Yeah.
and they couldn't handle it, and so they'd kind of gone crazy, so to speak. And he took it upon
Yeah.
himself to find these people and help bring them around to find out who they are. So that's what I
Ah,
meant by, the sensitives, that sometimes have more to deal with than the average
yeah.
person. There
That's
was a,
beautiful.
yeah,
Yeah.
there was I'll just mention one other source on this. There was a guy named Ernest Becker who wrote a
Hmm.
Pulitzer Prize winning novel called The Denial of Death back in the 70s. And
Oh,
he said there's sort of two kinds of people. He said there's the neurotics and the psychotics. He said the neurotics bite off less than they can chew, and the psychotics bite off more than they can chew. Does that make sense?
yeah. I would say so. I would say so. Yeah. Avoiders versus going in head into life. Yeah. And
Hmm.
all the realms. Yeah. Um, I think that, I often see, I was really interested when I was younger in working with people that were kind of gifted underachievers, if that makes any sense. So,
Hmm.
people that were really, really, really bright, but kind of got paralyzed by that brightness.
Hmm.
And so instead kind of turned inward, kind of turned inside, didn't want to disappoint people, were afraid of failure, afraid of success because, you know, maybe how would that change their image, afraid of not being able to sustain success, that kind of thing. And so, I was really interested in, you know, why some gifted people become really successful and why some gifted people, I mean, end up on the streets, really, and like, what's the difference? What are the risk factors? What are the resilience factors? What are the societal factors and the cultural factors? And I have found over the years, working with all kinds of people from all different backgrounds, ages, cultures, um, that, there is this, that there can be this paralysis of uh, multi-potentiality, like being good at a lot of things and not knowing where to put your energy, not wanting to disappoint people, having a lot of expectations from others, and not knowing when to listen to themselves and when to listen to others and what they're supposed to do. And so, yeah, it ends up paralyzing them, and it's a lot easier. Um, to take a time out, than to sometimes move forward with a particular path,
Yeah, that's
because there's a lot of anxiety, yeah, around it. Yeah.
absolutely. That's really interesting. Yeah. As you say that, I'm thinking of people on, well, particularly the Asperger's spectrum, autism being
The
a little
autism
more
spectrum.
severe than that in general. But I know a couple of people that would identify as Asperger's, and
Mm.
they're incredibly bright with amazing brains, but have maybe not used those abilities in society as much as they might have because of the sort of social, dysfunctions or, issues around that for themselves.
Yeah, and like Asperger's is called high functioning autism now.
Mm.
Because I mean, it's anyway, there's a lot of controversy about that and the whole DSM-5 and everything and changing labels and things like that. But um, yeah, I would say, people with autism, like high functioning autism, have higher cognitive abilities than average. And there's different, I would say there's different factors there, related to social difficulties and sometimes troubles with interpretations, things like that.
Hmm.
It's an overlapping category, I would say. There's I would say people with high functioning autism and gifted people overlap big
Yeah,
time,
interesting.
like in a lot of similar traits and things like that. Yeah.
Well, we're getting a little bit far afield from some of the main topics,
Yeah.
perhaps here, but that's okay. It's interesting to me
Yeah.
anyway. But I'd actually like to go back to ketamine a bit for a moment, if you don't mind,
Sure.
because
Yeah.
it's going to be taking an increasingly larger, more present role in treatment,
Yeah.
I believe, and it has one distinct advantage, obviously, which is it's legal for appropriate
It's legal
medical practitioners to use, and
and short.
I was just going to say that's the other one. Yeah, that's also convenient. So, um, you in the same little kind of monologue a little while ago, you referenced psilocybin and the cigarette,
Mhm.
addiction issue, and I kind of got the impression that the ketamine and psilocybin may be kind of doing a similar thing of what how they're helping, perhaps is by functioning as truth serums. They're showing people, uh, giving themselves a clear look at their life, and they sort of decide they want to take care of themselves, and they see this as a problem. Is it something
Hmm.
like that? I mean, would you say they
Yeah.
function somewhat similarly for one thing in that regard?
I mean, as you're talking, it kind of reminds me of what we were talking about earlier with cannabis, where when you like lifting the veil. So, I think both ketamine and mushrooms, like psilocybin mushrooms, have the ability to lift the veil. Um,
Hmm.
but but while the veil is lifted, you're in a state that is different than your everyday state. You're in a state that may be calmer, maybe less anxious, maybe more open to seeing what's underneath the veil, and being able to look at it with a more, kind of discerning, objective, uh, neutral mind than the mind that you experience every day. Does that does that make any sense? Like,
Hmm. Oh yeah, of course, yeah.
yeah, so it's less scary to lift the veil,
Hmm.
and start to look at things. It's more obvious, it's more clear, you know. Um, yeah, there's I ha this is a story I don't often share, but I back in 2008, I was in a major car accident. I was hit by a car on my bicycle, and
Wow.
I was in the middle of my PhD dissertation writing. Like actually, I was almost at the end. I was supposed to defend my dissertation in 2 months, and I got hit pretty badly. And the day after I got my concussion, I couldn't do anything physically. I was pretty much locked on the lying down on my couch. But for some reason, my brain said, "Oh, it's time to finish your dissertation," and I just wrote and wrote and wrote for like 2 days straight. And I finished my dissertation in 2 days that I had been kind of putting off, avoiding, struggling with for the previous year. And I sent it to my dissertation supervisor. He said, "A couple sentences didn't make sense in there, but wow, that was pretty good. Like you kind of did it."
Mm.
And I felt like what had happened with the concussion, and not that I'm comparing psychedelics to a concussion, but like, is that like something got knocked, something got kind of shut down, I think in my prefrontal cortex, where,
Mm.
in the exact place that I got hit. I think it was like right here. And it allowed me to kind of move forward without anxiety, without fear, without perfectionism, without thinking through all of like kind of negging myself, to all the potential ways of how I might mess up that manuscript. And in the same way with psychedelics, it's like they just turn something off. They turn some switch off that allows you to see yourself, without all of that chitter chatter, all of
Mm-hmm.
that kind of negative chitter chatter, and to show you like a potential way forward,
Mm-hmm.
like through it. Yeah.
Yeah, they talk about the quieting of the default mode network with psilocybin. They've studied that quite a bit, right? You know, but,
Yeah, with all of them, and I think, there's been studies on the kind of dropping of the default mode network and and like spending a lot of time in nature and meditation. I think the I think the neuroscience is still pretty speculative. It's a theory, it's a model, but it's a great analogy, for working with it in therapy. I talk about it all the time. It's like, oh, you're on this super highway every day with ideas kind of running around it, and you've got all this stuff from your past underneath the super highway that you don't have to think about or deal with. And when you're on the psychedelics, all of a sudden it's like the super highway crumbles, and there
mm,
you are face to face with everything. Old people, old memories, old things, but like you're okay, you're safe,
mm-hmm.
looking at all those things. And then you say, okay, what, what am I gonna work on today? What am I gonna bring into my car as I rebuild that highway, get back on the road and bring with me so I can kind of process it in day-to-day life? Yeah.
Nice metaphor. I like it. Um,
Thanks.
So, so again, sort of comparing and contrasting, perhaps somewhat, the psilocybin and the ketamine. Uh, um, I have a fair amount of familiarity with most of the sort of quote major psychedelics, but I've never tried ketamine, so I don't know how it functions particularly, other than what I'm hearing from people like you and others that I know about its, sort of truth serum function in that way. So let me ask you this: in the
Yeah.
Johns Hopkins work, like for example,
Hmm.
with end of life patients, terminal cancer
Hmm.
patients, it
Hmm.
seemed like a lot of, like they said, the people, that a lot of those people changed their attitude about their situation dramatically, and they were the ones that had what they called the most mystical experiences. So,
Hmm.
it's almost as if there's two streams of capabilities with some of these substances. One is the truth serum, more sort of narrowly, you might say, and the other one is that it shows you that you are in this larger, well, largest, you might say, environment that's like the eternal, loving, divine cosmos or whatever. And so people have a completely different perspective on who they are in that context, and that changes them. So does ketamine have any of that, or is it? I mean, I don't know what ketamine is. It's not truly a psychedelic, right?
Well, I mean, it depends who you ask. I mean, with the nomenclature and the specific neurotransmitter actions, it's not in a classical psychedelic category according to the researchers. But um, if you think about it in like the casual everyday conversation sense, like people have real visions, people
Mm,
see things, people, experience things. They have very transpersonal experiences. They have, experiences where um, they, yeah, become a different animal or a different person, and kind of
really?
go through,
Wow.
yes. Yes, yes. I mean, yeah, I will. Yeah, absolutely. And so it can be very profound. I mean, people, people can. My friend was telling me yesterday he was walking around Vancouver and he saw this poster on a kind of a pole and said, like, try 5-MeO DMT. And there's all these bullet points. It's like, meet God, do this, do this, do this, and we were laughing. It's like, what has happened? Like landscape when you see a sign like that on the street. But it's like, oh, here you can meet God for only $9.99. Just come into my house, and
I know, that's crazy.
um, yeah, but yeah, I mean, people have experiences of meeting their version of what God is.
Hmm.
In ketamine, I can't say everyone does, and in
No.
fact, I can't even say most people do. I will say that in with the clients that I've worked with ketamine, some have had mystical experiences, like in their sessions, like, well,
Hmm.
several,
Hmm.
in that kind of very scientific sense, of like how it's defined by Johns Hopkins. Um, some have had very, very extremely spiritual experiences. I'm not sure, actually, in the cases where I've seen huge reductions in substance use behaviors, that has been present.
Hmm.
Like with the clients I've worked with, they didn't have those experiences, and
Yeah,
it
interesting.
still changed their substance use. So, you know, uh, it's something to research. There's like so much research to be done on
Yeah.
all of this. It's like we're in like the almost like in the dark ages. We're like just hitting, I cannot wait to see what kind of research comes out in the next 100 years. Well, I'm not going to be around for a good chunk of that, but yeah, but it's really exciting.
Yeah, that's great.
I hope we spend the time before we get kind of carried away by the tide of what do they call it? Vitriol. Is that well, it's like all of the every it's amazing, everything's perfect. Oh, it's like you're guaranteed to have the most life-changing experience you've ever had. There's a lot of propaganda around psychedelics. They're amazing. They can really help so many people. But they're not for everybody. They can cause harms, especially out of context, like in a particular context. They can be used in ways that increase the harms, and so we have to be careful, and also like setting up expectations, for people that have been. I mean, occasionally, yeah, like someone comes in, they've been struggling with depression for 20 years. They've tried everything, every antidepressant under the sun, and they do a couple sessions of ketamine, and all of a sudden it's like, oh, they're looking at everything differently. Oh,
Mhm.
you know, things are able to start to move. They start to kind of see where, taking care of themselves fits into their life, how maybe they can change their work-life balance, how maybe they can spend more time with people they love, because the medicines like those, like ketamine, like psilocybin mushrooms, like LSD, even 5-MeO DMT, like these are the catalysts for change. If they can spark you to change things in your life that aren't working for you, that are creating the life that you are currently in, that you are not feeling, great. That's the ticket, But if you just take them and you have an amazing experience and then you go back to your regular life and you do things exactly as you did before, are you going to have a different life? Probably not. Are you going to have had a range of experiences that is different? Yeah, for sure. Might you have seen the light at one point? Yeah, you know, uh, but does it change anything about your life and the lives of the people around you? No, you know. So it's like you've got to do something. These are, I see them as gifts, you know. Uh, you know, uh, Many indigenous peoples. I mean, these have been used in indigenous cultures for so many so many years. Traditional cultures, and seeing these plants in particular as messengers of God, as or as gods themselves, and spirits themselves. So they're 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 teachers, plant teachers, they're medicine teachers, I guess, of how can we do things differently.
Absolutely. Well said. Thanks. Yeah.
Thanks.
And I agree completely about with everything you've said. And definitely the integration issue is a really important one. I've had that same, insight or thought numerous times that, there seem to be people that are around who have perhaps taken ayahuasca 100 or more times and haven't really fundamentally changed.
Mm-hmm.
There's you definitely have to find out how to bring that back into the daily walk. Uh, I'd still like to ask more about some of the specific medicines again. So I don't know how I'm going to get enough questions in the time we have allotted, but because you know so much about so many of these things, but I'd like to explore. Okay, so let's try this one first. You haven't mentioned MDMA yet. Have you
Mm-hmm.
worked with it, and how do you see it going forward, and how its efficacy, etc.?
Yeah, so I'm trained in MDMA therapy, from MAPS. It was part of my training at CIS. But no, I haven't worked with it in like in any of the research studies. Basically because there haven't been any that I could participate in working on.
Right.
Yeah, in Toronto, there's been a couple in Toronto, one on eating disorders, which is not something that is an area of expertise for me, and one on couples, which I'm a child, adolescent, and adult psychologist, but I don't do couples therapy. So unfortunately, like wrong place, wrong time for being a part of that research. But I have a lot of colleagues and friends that are doing MDMA research as part of they're the therapists on the MAP studies, which is the
Hmm.
bulk of what's being done legally in that realm right now. And I would say that they are reporting tremendous shifts, in a lot of the clients that they work with. But they're also taking real care, in working with those clients, and
Hmm.
maybe doing extra follow-ups, extra kind of work to ensure that those folks are well when they're leaving. Um, I think MDMA is a medicine that I want to keep learning about because it seems to have such positive effects for so many people. I mean, I've had clients that have come into me and said, everything changed for me when I did MDMA once. Several clients actually. I just
Hmm.
all of a sudden I accepted myself. I loved myself. I saw the world differently. It was a paradigm shift in how I thought about things. I was like, great. But for me, I mean, if someone gave me the opportunity to work on an MDMA study, I would sign up immediately. If someone gave me the opportunity to, sit in and observe, I would be there. But for me, I would say the jury's still a little bit out in terms of like who this is appropriate for and how it should be
Mm.
used and what are the steps, because I have seen, and um I'm trying to be careful in how I say this, but I have seen that, certain people don't do well with MDMA,
Really?
certain,
That I had not heard.
yeah, yeah, that some people with uh, specific trauma histories, especially in not the right care, um, you know,
Mm.
I've seen it act as a bit of a grenade. Okay. So I think it's a very, I'm not going to anthropomorphize it, but it's a smart medicine. Okay. It seems to have the ability, I don't know how this happens chemically or biologically, but it seems to have the ability to go like straight to, and I think MDMA, I mean, some have said it's like a derivative of a sassafras, right? But some have said, it seems that it has the ability to go like almost straight to the source of the trauma, straight to
Hmm.
the source of someone's issues. If you don't have a lot of trauma, well, great. You're probably going to have a lovey dovey,
Mm.
touchy feely time,
Yeah.
But if you have had serious trauma, I think it can go, as again before, like in one of two
Mm.
directions. Either you are, overcome with empathic, like self-love, love for others, connection, all that kind of thing. Or I have seen that it can kind of turn people quite inward if they're not prepared for what they're seeing. And I've seen people respond quite negatively. And, if you read some of the stories from the MAP studies, and I can't say that they're outliers, but, I would say the bulk of participants seem to be doing much, much better with MDMA. And this should be out there to help people, right? But there is a portion of participants that report almost as if they had open heart surgery and then it was like they were never sewed back up after the surgery,
Hmm.
right? So it's like,
Hmm.
it's like you have the ability, like MDMA seems to have the ability to open people up, like crack people open,
Hmm.
but there need to be a bunch of people there to help. Uh,
Hmm.
Kind of put some, kind of do the work with that person to help them put themselves back together afterwards, you know? And when they put themselves back together, they may be way better. They may be way better off. They may be way cleaner. That may have been a great surgery, you know? But I think sometimes it stops halfway through the surgery process. And that's what I'm worried about. And I'm
Hmm.
worried about people that are expecting like the lovey dovey, touchy feely, everything's beautiful experience and end up in this experience. And that's why I think it's really important, that there be a lot of support and care and follow up around work with MDMA, because I think it is a very powerful medicine.
Hmm.
Um, yeah, and
Yeah.
so I also kind of see it as neutral, kind of like psilocybin mushrooms. Ketamine, we say it veers towards the positive. Like
Yeah.
it's you might have people having some negative experiences, but it's innately kind of brings people towards positive
Hmm.
lenses. Um, Mushrooms, you can go either way.
Hmm.
LSD, I mean, you can go either way.
Hmm.
Ayahuasca, I don't know. I mean, I would even say maybe veers towards the negative. I'm not sure. I mean, it's a neutral medicine. It goes back and forth as well. But yeah, MDMA, I'm thinking more and more, I think we're going to see more and more examples of people that go this way instead of this way.
That's
Um,
yeah, well I'm really glad you talked about that. That's really interesting to me because I had not heard about that. And I've read a bunch on MDMA. I've experienced it several times in a therapeutic environment, etc. And I've never heard of anyone having a negative experience. Not that I've made a study
yeah,
of that, obviously. So this is
yeah,
really interesting. So
yeah.
tell me if this is if this is somewhat inaccurate. Then I've been under the understanding that the conventional view or understanding of how MDMA works. It's sort of a tripartite function, you might say. It, excuse me, as I understand it, and this is from what I've read from books like Gateway Through the Heart or Julie Holland's book on ecstasy, etc. It seems to do several things together that work together, and one is that it um, knocks out the fear factor of looking. This is we're maybe particularly talking about for PTSD. Um, uh, so you're the pro. I'm not. So excuse me if I don't get this quite right. But as I understand PTSD, it's one of the most difficult conditions to treat
Mhm,
because it can
mhm,
people either it's buried, they can't even look at it, or if they do, it can re-traumatize them, et cetera, et cetera.
mhm,
So my understanding of how MDMA works in a therapeutic context is that it knocks out the fear factor of looking at the situation and concomitantly brings in great compassion for yourself and for the situation. So you can look at it um, again without, sort of being re-traumatized. And the third factor apparently is, well, apparently I know this to be true personally anyway. It keeps your mind clear and your recollection and your linear thinking clear so that you can actually talk about it with the therapist and remember it afterward. Unlike, say, a major psilocybin journey where, so many things happen that you barely remember most of them because they're flying by so fast. So, is that a simplistic view of how MDMA functions?
Um, I'm going to be probably a lot of people will disagree with me, but I'm going to say yeah. I'm going to say that's how it works when it's working well, you know? And I would say that's how it works for a lot of people. I've also seen And I think if you ask MDMA researchers, you ask MDMA therapists directly, like, so is everybody really like in a not fear state, like in MDMA? Like, have people had tough experiences on MDMA? They'll tell you, yes, of course, right? Like, of course. The idea is that even if you're in a state of terror, okay, that like it'll be less so, you know. So you'll be more able to talk about it, more able to process it. You know, well, I think we've seen many examples in the MDMA research of it, yeah, doing that for a lot of people, knocking out that fear factor. But I've also seen many examples in my own life of it not like not totally knocking out that fear factor. And it just depends on someone's trauma history. It depends
Hmm.
on how, if you're dealing with someone with severe trauma or has had multiple severe traumas in their life, I'm sorry, but like nothing's that simple, I
Hmm.
mean, it is it quicker and better than without it? Probably, yeah, I would say so. I would say I would put my money on that, but is it instant, and is it an instant miracle cure? Yeah, for some people, probably, and so that's why it should be available. I just want to caution that it's not like that for everybody, because I've seen multiple examples where it hasn't worked like that for people. So it's just my sense is we have to be careful. We have to treat it like it's a powerful medicine,
Hmm.
Um,
Yeah,
yeah,
that's really
one
good
that
to
should
hear.
be, yeah, I just, you know, I guess I'm fortunate to know many people that, um, I have a lot of friends, colleagues that have had incredible experiences on MDMA, changed their life. I've seen so many clients, it's changed their life. I mean, the studies it's hard to refute all of the research that's coming out of MAPS, even if there's some issues with it, like over by and large, there are a lot of good data in those studies. Um, at the same time, we also need to be realistic that there are going to be people. I know many people that haven't had those kinds of experiences. I've also known people, that have tried to take. I've had clients that have tried to take MDMA on while they're on antidepressants, obviously not under my direction, and they have no experience, because of different serotonin interactions, kind of
Hmm.
blockages. So yeah, I'm not to belabor the point, but I would just say it's not all sunshine and rainbows.
Yeah.
There's darkness. There's as well.
Yeah. No, I've not
Yeah.
heard that, so I really appreciate hearing that. So coming back to ketamine for a moment, if I may, because I know it's a major
Yeah.
focus for you in your work as well.
Yeah.
I want to ask you, actually, this was not a question I was going to ask you, but I want to ask it now anyway. Someone I know um, who's been on SSRIs for many years would kind of like to get off them if possible. Um,
Hmm.
and I mentioned ketamine uh, has shown some promise with depression. And her first question was, are there contraindications? So I looked that up and
Hmm.
got information from Yale Medical, for example, Yale Medicine. John Crystal, I think, head of chief psychiatrist at Yale Medicine, said, in a general sense, no. There are some situations, and I think it's SNRIs that cause something like increased heart rate or some heart problems with some people, but limited usually. So I'm just wondering, would you agree that essentially there's no serious concern about contraindication? In fact, I think it was this John Crystal guy, either that or somebody from the University of California, San Francisco, who said they actually encourage people who come in for ketamine treatment to stay on
Hmm.
their medication during the treatment period. So, do you have any relevant comments about that?
Sure. I mean, I'm not a medical doctor, but I worked at a ketamine company for 2 years and leadership there, and we had a lot of discussions about this. And the research and data seem to show that it's that. there aren't serious concerns about being on antidepressants whilst on ketamine. And it's kind of one of those psychedelic. It's one of the, if you allow it to be included in the psychedelic category, it's one of the psychedelics that you can be on several medications without serious interactions or issues, and that's why it can be a really realistic medicine for a lot of people that wouldn't be able to, like, if I mean, from any work that I've done with ayahuasca over the last couple of years, like it's very clear, that people need to be off antidepressants before using ayahuasca, or there can be potential serious consequences. With psilocybin mushrooms, I think they're still trying to find real data on whether there is an issue with like serotonin syndrome, which is kind of always the cited concern. And same with MDMA, and from what I've observed anecdotally, and this isn't medical advice, it's that it just seems to blunt the experience, more for people, and I think they need to do research to show whether there really are like long-term effects or more serious effects from that. But with ketamine, yeah, people can, I have even people with like seizure medications, with antidepressants coming in. Usually, we would, like the medical team in a ketamine care would recommend people, at least for my patients that I've done therapy with, might recommend that they're off their stimulant medication, like, if they're on ADHD medication, that they're off any like benzodiazepines or anti-anxiety kind of drugs. That there's certain things you take a break from. When I was at Field Trip, we even recommended people stay off of cannabis for 48 hours, front and back, just so that people had it seemed to mute the experience. It seemed to mute the experience and also the memories. And so that's it. But yeah, it can be. I mean, when I have clients that have been on antidepressants for a long time and seem interested in breaking off of them, but are afraid, of the potential impacts of depression coming back, things like that, or unknown consequences of getting off of them. It seems that ketamine is being used. It's a kind of is being seen as a safe way to proceed. I mean, I recently had someone I was working with that I cleared through psychiatry, neurology, family doctors, nurses, because I just wanted to make sure we're all clear, on all fronts. And everybody said, yeah, should be fine, should be fine. So, so yeah, it seems to be a very safe medicine.
That's good to hear. So I'm not sure, if you feel like you have the knowledge to speak about this part of it, but this is really important for people in that situation as well. So the follow-up question, I had several email exchanges with this person that I mentioned, and her next question was, so what about after? Because as I understand it anyway, it's really difficult to get off of SSRIs. You, for one thing, have to go really, really slowly. And then, people are worried about that they'll, without that drug in them, they're going to fall back into depression again. So, does ketamine have any impact on the trajectory of how you can get off your SSRI afterward? Do you know about that?
It's a really good question. And I would say, one thing I often ask people that, come in to see me that have been on antidepressants for, let's say, 5 years, that are very depressed, is I say, is it working for you? Like, if they're afraid to get off of it, I say, is it keeping you from depression right now? And they might say, no, it's not keeping me from depression. Okay, so like, let's just say the hypothesis that your antidepressant isn't helping you, okay? Because it's not keeping you from depression, which is the point of an antidepressant, right? So if it's not keeping you from depression, likely it's not keeping you from depression. And so the idea of depression rebounding afterwards is, I would say, unlikely, less likely, because you're already depressed. right? So it's the other things that people struggle with, calming off of antidepressants, um, you know, shakes, jitters, problems sleeping, um, you know, uh, cold sweats, anxiety. Like I've seen a number of different reactions to SSRI withdrawal. It's a whole syndrome now, officially. The longer that someone has been on an antidepressant, the harder it can be. The higher the dose, the harder it can be. And so I think that, as a society, we really need to start looking at all of the people that have been on antidepressants for 20 years, 25 years, or even 30 years. I mean, I've seen people that have been on antidepressants for like 34 years, believe it or not, since like the dawn of antidepressants.
Mhm.
And when they were originally prescribed, and people seem to forget this, it was said this is supposed to be something that you're using for 6 months to a year with the help of a doctor or a therapist to help you, to kind of give you the state of mind to work through your issues. Um, and then you can get off of the antidepressant. So originally when they were being marketed, and that was in like the late 90s, early 2000s, that's what people were supposed to do. It was like you're on it for a short time, you're working with someone, it's supposed to help you kind of pull you out of your funk to be able to do that. And then the idea is to wean off quickly. But something happened along the line where people just started prescribing antidepressants, forgetting all the therapy part, forgetting the care part, forgetting the
Mhm.
changing anything in your life part, and just seeing it as like a daily a daily thing that you just have to do to keep at where you're at.
Yeah.
Um, so it's a whole mindset, like a societal mindset about these things, and more research is coming out over the last many years, really since the early 2000s, about how except in the cases of severe depression, a lot of antidepressants can function as a placebo, you know.
Mhm.
And so a lot of people are like, you know what, this isn't helping with my depression. This isn't helping with my panic attacks. I don't even want to be on this. I don't want this thing. So, I mean, antidepressants help who they help, and they really don't help who they don't help.
Mhm.
And so for the people that they really don't help and who want to get off of them, sometimes I would say, I think we haven't done enough research on this, if any. But I would say that ketamine, something like psilocybin mushrooms, if done in the proper context, proper scenario with proper support, could potentially help someone get into the mindset where they would be able to see themselves getting off of a substance like that. And not only that, but in that process of lifting, being able to integrate the self-care behaviors like exercise, like spending time with people they love, like good sleep habits, like good hobbies, good work-life balance, that will allow them the foundation, like the structural foundation, to be able to deal effectively with any withdrawal symptoms that begin when they start to get off of the antidepressants.
Mhm.
Because
Yeah.
people can get through it, but it takes a solid foundation of like, okay, I'm ready. I've got my skills. I've got my coping skills. I know this is going to be tough for a period. Maybe it's going to be tough for 6 months. Maybe it's going to be tough for a year, but I'm going to get through it, and I'm going to be okay on the other side. So
Nicely
I
put.
think could psychedelics kickstart that process? I think so.
Mhm.
But again, we need to show this in research. Yeah.
Absolutely, yeah. Well, there's a lot more we could talk about. Excuse me a second. Um, but I think this might be a good place to wrap it up, despite the fact that there was a few things we didn't get to, including I think you indicated before we got on the recording that you've been focused a lot on the scalability of psychedelic therapy and stuff like that. I don't know, maybe uh, I do need to wrap this up actually from my end, but
Yeah.
maybe do you think you could squeeze it down to like 49 words or less, like how we're doing on the scalability issue?
Yeah, I would like the things about the scalability issue is I would say if you find yourself doing well in the psychedelics space, and you want to expand, I always ask people a couple questions first, which is, why do you want to expand? You know, Is it to help more people? Is it to reach more people? Is it related to accessibility? Or is it related to some other objective like money, you know, ego, whatever, and because I find that when people are doing something really well and they're really helping people and they start to expand, that's a natural expansion. That's a natural scaling, right? And
Mm-hmm.
that's going to happen, and that's something that can be encouraged. But when people are struggling with even maybe the business or the situation that they have, they're not helping that many people, or maybe they're just looking to get big for the sake of getting big. I think it's it's something that will eventually collapse,
Mm.
or eventually shrink, because it's not held by any solid or strong foundation of intentionality and care and compassion. Um, yeah, it's hard to sum it into 49 words, but
Mm.
I think I help people with thinking through the whys of scalability,
Mhm.
and then the hows, depending on the answer. Yeah,
Okay, well, thank you. I know that was sort of unfair to ask you to summarize work you've been
that's
doing for quite
okay.
a while. Um,
It's okay.
yeah. So, so before we go, is there anything? So this is going to go on YouTube and on some of the audio platforms like Spotify, Apple Podcasts, and all that. So, is there anything that a viewer or listener you would like them to check out, uh, to follow up with some of these ideas?
Yeah, sure. I have a website. It's one I made myself. So that being said, it's drmorisano.com, drmorisano.com. And also, I'm going to be teaching a course with Fluence coming up in March on the foundations of psychedelic therapy, like psychological approaches. And I am going to be doing some work with Beckley Retreats in Jamaica, around working with people with psilocybin mushrooms, and providing some support around that. These are some things people can check out. I've been on a couple podcasts on psychedelics today, one on celebrating women in psychedelics. Those are where I talk more about things I'm interested in. So I really appreciate you having me today on the show.
Well, you're a font of excellent information. I really appreciate it. So, if people are interested in some of these workshops or retreats, they can find out through your website.
Yeah, and also I would encourage people to look at the website from our conference from last year. It's only about 8 months, or probably only about six months old. It's from researchtoreality.com, and we have open access videos of the entire conference. It's a pretty wonderful thing, and so I encourage people to check those out as well.
Great, excellent. Well, thank you very much. Okay.
Thanks, Stephen.